Next up, we're going to be transitioning to Rodney Bell, the CEO and founder of Sanitas Health. Rodney, you could start to take yourself off of mute. Sanitas is a psychology-based language analysis platform for understanding human emotions, personalities, motivations, and psychology from everyday language. Rodney, can you take it from here?
Thank you very much. I'm going to share my screen, see how well that goes. Can you see the screen now?
Looks great.
Great. I'm Rodney Bell. I'm the co-founder and CEO of Sanitas Health. I'm going to start by telling you a story about one of our clients. Los Angeles County USC Medical Center is the second largest public hospital in America. They see about 150,000 people each year in their emergency room. And that's about 11% of all ER visits in the United States. The majority of these ER patients, unfortunately, are Black and brown. And 20 to 30% of them are on Medicaid. And 40% of these visits are visits related to mental health for which the ER is not prepared to address. With 1 in 4 Americans suffering a need of some sort of mental health and/or support and an insufficient number of therapists, there's a supply and demand problem for mental health services. And this problem is significantly worse in communities of color and underserved populations, which leads to 3 problems that Sanitas was designed to address. 1, there's a revolving door for ER visits around mental health needs in this country. 2, there's what we call a waiting room problem, with people often waiting months, sometimes longer, to see a mental health specialist, which leads us back to problem 1, they're back in the ER. And problem number 3, there's a lack of culturally competent care in this country, with 75% of the doctors in this country identifying as white and 45% of the population identifying as non-white. Sorry, guys. The supply and demand problem that we're talking about is not getting better. It's getting worse. It's projected by the year 2028, there'll be 50% fewer psychiatrists in this country than there are today, and there'll be 28% fewer psychologists in this country than there are today. This problem is not going to be addressed unless there's a solution to address it that's a digital solution. We've invented Sanitas, which is a 3-stage AI-based tool that uses natural language processing to understand patient conversations and provide personalized care and therapy to each patient. Our approach is a very different approach than most mental health apps you've seen. We have a little quote called therapy last versus therapy first. We have a 3-step graduated approach. We have 70 moderated, virtually moderated peer-to-peer support groups, stage 1. Stage 2, if that level of care is not sufficient, we'll escalate to 24-hour-a-day, 7-day-a-week text-based coaching with certified coaches. And stage 3, if absolutely needed, we'll advance you to a culturally competent therapist. We can provide teletherapy. The application looks something like this: peer group, text-based coaching, culturally based therapy if absolutely needed. Sanitas is preventative care in nature. Not only does Sanitas yield positive mental health results, but it's also very good business. Every $1 spent on prevention results in $10 in savings. Student retention rates are higher because they're not leaving school because of mental health reasons. Insurers and hospital systems save millions of dollars for the uninsured population that's in the emergency rooms. The market for us is extremely large. The global market is $4.5 trillion. We see a $385 million opportunity for us in the next 3 to 4 years. We're a B2B2C solution. Our customers contract with us on a monthly basis, and the end user never pays a dime to us. They're paid for by the institutions. Today, our traction, we've grown about 40% per average month over month in monthly recurring revenue. We're right now on track to do $480,000 this year in annual recurring revenue, and that's growing continuously. These are some of our clients, large national organizations as well as local organizations in the state of Maryland and the city of Baltimore. We're here to raise $1 million in the form of a safe note. The milestones are very simple. We're going to continue to build out the AR platform, train the algorithms, and onboard at least another 200,000 patients in the community. I'm Rodney Bell. This is our team. I'd love to take your questions. Thank you.
Thank you so much, Rodney, for the fantastic presentation. Great work that you're doing here in the mental health space. It's very much needed. Just going to be handing it off to the first person of this portion of the judge Q&A. It is Erin Hagan, the Deputy Director of Evidence for Action. Erin, thanks a lot for joining us.
Thanks, Alessandra, and thanks, Rodney, for your presentation. I wonder if you could start by talking a little bit more about your model for how you'll reach the patients and clients. Is it that you're going to the providers and then they're referring this platform to the patients, or are you going directly to them? And I'll just add quickly, if it's the former, then how have you thought about, because I'm sure you're aware, the people who aren't getting to the providers to begin with, and whether or not this solution will help to reach those people who are not connected to medical providers to begin with?
A great question. Typically, we would work with managed care organizations and the like, but to reach those people who are not in the system, which is the most needy population, we actually work with a lot of adolescents. So our clients are like the Boys and Girls Club, the Y, public school systems. So, for example, the Baltimore Public School District is one of our clients. So we meet kids when they're in 8th grade, whether their parents have them in the medical system or not. They belong to the Y. They belong to the Boys and Girls Clubs. So we contract with the Y, the Boys and Girls Club, the school system itself. So then they refer the kids to us directly.
That's great. I love that model of sort of partnering with different types of organizations outside the healthcare sector. Thanks for that answer.
Yeah, we thought about healthcare systems, hospital systems, but those are big, massive behemoths with tons of bureaucracy. You'll never get anywhere that way running this kind of business. So we went to the kids directly, to the schools.
Great. Thanks so much.
Thank you so much, Erin. And next up is Dr. Tarika McCall of the Yale School of Public Health, assistant professor there. Thank you so much for joining us, Tarika.
Thank you so much. And thank you, Rodney, for the presentation. So I like that you have this, 3-tiered approach, right? Where they can get peer-to-peer coaching, text-based support, and then if needed, be kind of linked to a therapist. And so I wanted to ask more about, you mentioned using AI and natural language processing. So the data sources that you're using, is that from what the user is inputting into the app, or is that, or where are you getting your data sources?
Great question. We don't talk a lot about that in the presentation because it gets really boring. What we do is all of the free text, not that the question is boring, it's just that the answer is boring. All the free text and all the conversations that are taking place in the peer groups and the conversations that are taking place in the text-based coaching and the therapy notes, all of that free text is going into our database. And what we're trying to identify there are biomarkers of depression, anxiety, stress within our communities. And then, so we're trying to train algorithms to be more predictive of that, so we can actually work with community leaders and the like to let them know there's a crisis coming. This is how your population is feeling right now. So all of the data is between patient and doctor. But in this case, it's primarily between a BIPOC patient and a BIPOC doctor. So this data set that we're collecting doesn't really exist today. So we're trying to understand our community from a doctor-patient relationship and conversational standpoint.
Okay, I think that's awesome. And I won't take up too much more of your time, but is then the hopes then that the therapist will use this to kind of tailor the treatment plans? And is there some thought to providing some recommendations, some insights specifically for the users that they can use for self-management as well?
Absolutely. This goes to the core of why we founded this company. We came here with lived experience as well as just general business experiences, but we are very curious about whether CBT, DBT works for everybody. We, quite frankly, don't think it does. So we're trying to prove that point by suggesting, for a different population, for a different subset of a group of people, there may be different tools to use. So we're going to explore that. And then we're going to make recommendations to people like yourselves and other professionals in the field. Hey, guys, listen, maybe when you're dealing with kids in urban Baltimore, CBT is not the answer. Try this. So that's exactly where we're going.
Thank you.
Thank you.
Thank you so much, Rodney, for your answers. And thank you, Tarika and Erin, for your fantastic questions over here.